afternoon, classmates and mom carms. Praise be Jesus and Mary. In this video, we will present our report about the sensorimotor system. We hope that you will find our presentation both informative and worthwhile.
So, good day everyone. Today, I will be talking about audition. Audition plays a crucial role in guiding actions and coordinating movements. Auditory information is processed for temporal precision and is used to predict the auditory consequences of our actions, influencing motor control and error correction. So, in simpler words, audition doesn't just mean hearing, it actually helps us move and act more accurately. So our brain uses sound for precise timing, like when we clap along with music. It also predicts what we should hear when we make a sound. So if something is off, we can quickly correct ourselves. So this connection between hearing and movement is why sound is so important for coordination. In this slide, I will be talking about audition's role and sensorimotor timing. So first one is temporal precision. Audition is often considered superior to vision in guiding temporally precise movements like sensorimotor synchronization or tapping in time with a beat. So this means that our sense of hearing is more accurate than vision's when it comes to timing. For example, when we tap or clap along with music, it's our hearing, not our sight, that keeps us on beat. Second is auditory feedback. Hearing the consequences of our actions, such as the sound of speech or musical instruments, is essential for motor control and error correction. This is about how sound helps us monitor and correct what we're doing. When we talk, we listen to ourselves to adjust if we're too soft or mispronounce a word. Musicians do the same. They depend on sound to stay in tune and fix mistakes. Third is sensorimotor predictions. The brain anticipates the auditory feedback from movements, allowing for adjustments and fine-tuning of actions. Our brain doesn't just wait for sound, it predicts what we should hear. For example, when pressing a piano key, we expect a certain note. If the sound is different, our brain quickly notices and helps us adjust. 4 is neural basis. Studies suggest tight connections between auditory and motor cortices, potentially driven by vocal learning, contribute to auditory motor interactions. So, research shows that the brain areas for hearing and movement are strongly connected. This close link may have developed through vocal learning, like how we learn to speak by listening and copying sounds. These connections explain why sound and movement work so well together. Mediums of sound. Usually through air, but sound can also move through water and solids. Example is when you hear someone knocking on a wall. Sound mostly travels through air, but it can also pass through water and solid objects. In fact, sound travels faster in solids because the molecules are packed closer together. That's why if someone knocks on a wall, we can clearly hear it through the solid surface. Some materials like fabric absorb sound and make things quieter. Soft materials like curtains or carpets absorb sound waves. This reduces echoes and makes a room quieter. That's why soundproofing often uses fabric or foam panels. Others reflect sound, which animals like bats use for echolocation. They make sounds and listen to echoes to see in the dark. Hard surfaces reflect sound instead of absorbing it. This reflection creates echoes, and some animals like bats and dolphins actually use this to their advantage. They produce sounds and then listen to the echoes bouncing back, which helps them detect objects and navigate even in complete darkness. Now, I will be talking about sound as a physical stimulus. So, where it starts, sound begins when something moves or vibrates, like a guitar string or your vocal cords. This shows us that sound always has a physical source. Without movement or vibration, there would be no sound at all. How it travels. The movement makes the air molecules bump into each other, creating waves of high and low pressure that spread outward, like ripples when you throw a stone into water. This spreading pattern is what allows sound to reach our ears, even if the source is far away. Why no sound in space? Since sound needs molecules to travel, it can't move in a vacuum. or outer space. That's why the boom in Star Wars is just for fun. It wouldn't really happen. In space, explosions may look dramatic, but they would be completely silent to us. Echolocation example. The bat is able to navigate through small openings in nylon mesh in total darkness by using echolocation. This shows just how powerful echolocation is. Even in complete darkness, bats can see with sound. They produce high-pitched sounds that bounce off objects, and by listening to the echoes, they can figure out the exact size and location of openings, even something as small as gaps in a nylon mesh. This ability lets them fly and hunt at night without bumping into obstacles. The three main characteristics of sound waves: amplitude, frequency, and timbre. Each of these affects how we actually hear and experience sound, like whether it's loud or soft, high pitch or low pitch, or even what makes one instrument sound different from another. I'll explain each of these in more detail in the next slide. First one, amplitude, height of the wave. Big wave equals loud sound, small wave equals soft sound. This means that the size or height of the sound wave determines how loud or soft the sound is. The bigger the wave, the more energy it carries, which we hear as a loud sound. A smaller wave has less energy, so we hear it as a soft or quiet sound. For example, shouting creates bigger waves than whispering. Second one is frequency, how fast the wave cycles. Slow cycles / long waves equals low pitch, deep sounds like a drum. Fast cycles / short waves equals high pitch, sharp sounds like a whistle. Here, frequency is about how fast the sound waves repeat. If the cycles are slow and the waves are long, we hear a low-pitched sound, like the deep thump of a drum. If the cycles are fast and the waves are short, we hear a high-pitched sound, like the sharp sound of a whistle. So, frequency tells us if a sound. Types of sounds. Pure tone, one single frequency, like a tuning fork. A pure tone is the simplest type of sound. It only has one frequency, so it sounds very clear and steady. A good example is a tuning fork. It vibrates at just one frequency, which musicians often use to tune their instruments. Most sounds, mix of many waves together. Most of the sounds we hear every day are not pure tones. They're actually made up of a combination of different frequencies. For example, when someone plays a guitar or sings, the sound is a mix of many waves, which is why each voice or instrument sounds unique. Noise, waves that are irregular and don't repeat, like clapping, static, or city traffic. Noise is different because it doesn't follow a regular pattern. The waves are irregular and messy, so they don't create a clear pitch. Examples include clapping, the static from a radio, or the mixed sounds of cars and people in city traffic. Noise is basically all the random sounds that don't have a steady tone. To sum it up, sound is just vibration that moves in waves. The taller or higher the wave, the louder the sound we hear. The faster the waves repeat, the higher the pitch of the sound. This is the basic principle behind all the sounds around us. Intensity, or how strong a sound is. Sounds can be soft like a whisper or super strong like a rock concert that makes your chest vibrate. This shows that sound intensity can range from very quiet to extremely loud. For example, a whisper is gentle and barely noticeable, while a loud concert can make you physically feel the vibration in your body. Intensity basically tells us how powerful a sound is. To measure this wide range, scientists use a special unit called the decibel, or dB. Since sounds can be very soft or very strong, scientists needed a standard way to measure them. That's where decibels, or dB, come in. This unit lets us compare sounds from the faintest we can hear, like rustling leaves, to extremely loud and even painful sounds like a jet engine. Key points about the decibels. 0 dB, the softest sound most humans can hear, like a mosquito buzzing 3 meters away. This is the lowest level of sound we can detect. Anything softer than this is usually inaudible to the human ear. 20 dB, a whisper. A whisper is very soft but still clearly above the hearing threshold. 60 dB, normal conversation. This is the sound level we experience every day when talking with others. 120 dB, really loud, like an iPod at full blast. At this level, sounds are extremely loud and can already be uncomfortable to the ears. 130 dB and above, painful and can damage your ears permanently. Gunshot near the ear is about 140 to 170 dB. Sounds this strong don't just hurt, they can actually damage hearing permanently, especially if exposure is repeated. Frequency. Frequency is how many times a sound wave cycles in 1 second. It's measured in hertz. Frequency is all about how fast the sound wave vibrates. The faster it cycles, the higher the frequency, and the lower it cycles, the lower the frequency. We use hertz or Hz to measure it. 1 hertz means 1 cycle per second. Example, 500 hertz. The wave repeats 500 times in 1 second. So if a sound has a frequency of about 500 hertz, it means the wave is repeating 500 times every second. Higher hertz values give us higher pitch sounds, while lower values give us deeper low pitch sounds. Pitch and timbre. Pitch is how high or low a sound is. Low frequency is equals to low pitch, like deep voice or drum. High frequency is high pitch, like whistle or bird chirp. Pitch is what we hear when we describe a sound as high or low. If a sound has a low frequency, like a drum beat or a deep voice, we hear it as a low pitch. If it has a high frequency, like a whistle or a bird chirp, we hear it as a high pitch. So pitch is directly tied to frequency. Now, timbre. Quality of the sound, what makes the instruments or voices sound different even if they play the same note. Example, a piano and a clarinet playing the same note have the same pitch, but they sound different because of their harmonics, extra waves that add richness. Timbre is what gives sound its unique character or color. For example, if a piano and a clarinet both play the same note, they're producing the same pitch, but you can still tell them apart. That's because of timbre, which comes from harmonics, extra vibrations that add depth and richness to the sound. Special frequencies. Ultrasound, above 2000 Hz, too high for humans to hear. Used in medical imaging, like checking babies in the womb, also used for cleaning delicate objects. Some animals, like bats and dogs, can hear it. Ultrasound refers to sound that's too high-pitched for humans to hear, anything above 2000 Hz. Even though we can't hear it, it's very useful. Doctors use ultrasound for safe imaging, like when checking the health of babies during pregnancy. It's also used in technology, such as cleaning delicate items like jewelry. Interestingly, some animals like bats and dogs can actually hear these very high sounds. Infrasound, below 20 Hz, too low for humans to hear. Used by animals like elephants and whales to communicate over long distances. In humans, very low infrasound can cause dizziness, nausea, and discomfort. Researchers even study it as a possible non-lethal crowd control tool. Infrasound is the opposite. These are sounds too low for us to hear, below 20 Hz. Animals like elephants and whales use infrasound to send signals across very long distances. For humans, exposure to very low infrasound can be unsettling, sometimes causing dizziness or nausea. Because of these effects, scientists are even exploring it as a possible tool for non-lethal crowd control.
Thank you for that, GP. So now I will discuss about the structure and function of the auditory system. The components that make up the ear are generally divided into 3 parts, which is the outer ear, the inner ear, and the middle ear. So first, let's discuss about the outer ear. The outer ear includes the parts you can see above the presentation. So first is the pinna, with the visible ear outside your head. And then the auditory canal, which is the ear canal or a short tube inside your ear. Now let's talk about their function. The pinna works like a funnel. It collects sound waves and directs them into the ear canal. It also helps us find where a sound is coming from. For example, dogs move their pinna, which is their ears, to move each sound or to show emotions. like ears back when they're angry, while the auditory canal is a short tube about 2.5 centimeter long and 7 millimeter wide that carries sound to the. In short, the outer ear contains pinna and ear canal. The pinna collects and focuses sound, while the canal funnels sound inward to the next part of the ear. Now let's move on to the middle ear. The middle ear sits between the outer ear and the inner ear. There are boundaries inside the middle ear. First, the tympanic membrane, which is the eardrum, separates outer ear from middle ear. And then the oval window separates middle ear from inner ear. Inside the middle ear are three tiny bones called ossicles. First, the malleus, which is the hammer, and then the incus, which is the anvil, and then the stapes, which is the stirrup. Their job is to transfer sound from air into fluid of the inner ear without losing too much energy. For example, when you're underwater, voices sound unclear because sound loses energy moving from air to water. The middle ear solves this problem. How the middle ear boosts sound? Lever action. The ossicles are connected like a hinge. This increases the force of vibration. Pressure boost. The eardrum pushes force into the oval window. This makes pressure much stronger. So together, these tricks recover about 23 decibels out of 30 decibels that would normally be lost.
And let's proceed to the inner ear. So the inner ear is the deepest part of the ear, and it's responsible for turning sound vibrations into electrical signals that the brain can understand. And here are the main parts. Number one is the semicircular canals. It is the part of the ear that balance system or the vestibular system. Number two, cochlea. It is a shape like a snail, about the size of a pea. This is the hearing part of the inner ear. And inside the cochlea is a fluid field that has three chambers. Number one is the vestibular canal. It contains parallel. Number two, it is the tympanic canal. It also contains parallel. And last, the cochlear duct that contains indolin, which is rich in potassium. These chambers are separated by membrane. Number one, Rainier's membrane. It is located between the vestibular canal and the cochlear duct. And then there is basilar membrane. It is located between the cochlear duct and the tympanic canal. Sound enters through the oval window that is pushed by the stapes bone and exits through the round window, causing fluid waves inside. These chambers are separated by membrane. Number one, Rainier's membrane. It is located between the vestibular canal and the signal duct. Number one, inside the cochlear duct, basilar membrane. The organ is located between the cochlear duct and about 15,500 sound enters through the oval window. These hair cells are the receptors for hearing. Number two, and exits through the round inner hair cells has 3,500 hair cells. The main hearing receptors that send the most signals to the brain. And the outer ear cell. It has 12,000 that help amplify sound and makes hearing more sensitive. Hair cells has tiny cilia or hairs sticking out. When sound waves move through the basilar movement, the cilia bend back and forth. This bending often or closes potassium channels. Potassium movement in spatial cases, in most neurons, potassium leaves the cell, but in the endolymph, potassium concentration is high, so it flows into the cell instead. This depolarize the hair cell and open calcium channels and releases glutamate as a neurotransmitter. Cortex. So the primary auditory cortex, or the Heschel's gyrus, is located in the temporal lobe just below the lateral fissure. It organizes in columns, and each tune is specific frequency, like piano keyboard inside of your brain. It has low frequency, the front rostral part of the Heschel's gyrus, and the high frequencies, the back or caudal part of the Heschel's gyrus. Some columns prefer both area together, binaural, while others prefer input from just one ear or monaural. The other neurons respond to intensity, loudness differences. This area helps us detect basic sound features like pitch, loudness, and which ears the sound came from. Secondary auditory complex surround the Heschel's gyrus and handles more complex sounds like clicks, bursts, and patterns. In monkeys, for example, some neurons respond specifically to the vocal sound. In humans, this links to speech processing Wernicke's area. So it is found at the junction of the temporal and parietal lobe. Its special role is to comprehend language or understanding the speech. In short, primary auditory cortex or Heschel gyrus analyze simple features like pitch, loudness, and ear input. The second auditory cortex analyzes complex patterns like voices, speech-like sounds, and the Wernicke's area gives meaning to a language.
We associate pitch, the high or low quality of a sound, with frequency. Although that is an overly simplistic view, pitch can vary due to the factors other than frequency, such as the intensity or context of stimulus. Example for pitch perception, think of a piano keyboard. High notes are on the right side and then low notes are on the left. In your ear, the basilar membrane, which is inside the cochlea, is like that keyboard. Different spots respond best to different pitches. If a sound is high-pitched, like a bird chirping, it presses the part of the membrane tuned for high notes. If a sound is a low pitch, like a drum, it presses the part of tune for low notes. This idea is called place theory. The place where the membrane moves the most tells your brain the pitch. But for lower pitches below 4,000 Hz, your brain uses frequency theory, like counting how fast the sound waves are coming in, similar to tapping your finger in time with the beat of a slow song. Pitch perception is our brain's interpretation of sound's frequency, allowing us to distinguish between high and low notes, and to understand musical melodies and speech. This complex process involves two main theories: the place theory, which suggests pitch is coded by the location on the basilar membrane that vibrates most, and the temporal theory, which posits it's coded by the timing of nerve cell firing. Loudness perception. Although the decibel level of a sound wave and its perceived loudness are related, they are not the same thing. Decibels describe the physical qualities of the sound stimulus, whereas the loudness is the human perception of that stimulus. The perception of loudness does not change at the same rate as the decibels do. Imagine you have a water faucet. The decibel level is like how much you turn the faucet handle. It's the actual amount of water flowing. Loudness is like how strong the water feels when it hits your hand. It's the experience, not just the measurement. If you turn the handle from 3 to 4, adding to 10 decibels, the sound doesn't feel just a little louder. It feels about twice as loud. Our ears don't treat all pitches equally. Low sounds like a bass drum at the same decibel might feel softer than high sounds like a whistle. But if the volume is really loud, like from 80 to 100 decibels, all pitches start feeling about equally loud. And like when water pressure is so strong, you can tell small difference anymore. Your ears' neurons are like workers. Our worker, which is the neuron, can handle only a certain loudness range, about 40 decibels. But when sounds get louder, more than the workers join in to help, the recruitment makes the sound feel even louder. Localization of a sound, our primary means of localizing sound in the horizontal plane. How we tell where a sound comes from. Sound to the side, perpendicular. If a sound is to your right or left, it reaches the closer ear first, about 0. milliseconds earlier, and is louder in that ear. Your brain uses this timing and loudness difference to pinpoint the direction. Sounds in front or behind. If a sound is directly in front or behind you, it reaches both ears at exactly the same time, 0. milliseconds difference. This makes it hard to tell if it's in front or behind without turning your sound at an angle 45 degrees. If a sound comes from a diagonal direction, the time difference is in between, about 0.3 milliseconds. Your brain still notices this tiny difference to figure out where it is. Imagine you're in a dark room and someone drops a pencil. If it falls to your left, the sound hits your left ear first and is a little louder there. Your brain instantly says, "It's on my left." If it drops directly behind you, the sound reaches both ears at the same time. So you might turn the wrong way at first, maybe thinking it's front of you. If it falls above you, like from the shelf, the way the sound bounces off your ears curves. Like the peanut tells your brain that's come from above. If the pencil is behind the box blocks some sound, making it suffer in the far ear, just like a shadow but for a sound.
And let us move on to hearing disorders. So hearing disorders occur when there is a problem with the ear or the parts of the brain that process sound. They can range from mild, such as difficulty in hearing of soft sounds, to severe, where an individual will not hear at all. Hearing problems can significantly affect communication, learning, and overall quality of life. Number 1. Legal deafness. A person is considered legally deaf if they cannot hear speech sound at 82 decibels or softer. For comparison, normal speech is around 60 decibels, and this legal definition is important for determining eligibility for special services, education, support, and assistive devices. So these are the common causes of hearing loss. Number 1 is aging. Hearing ability naturally declines with age, and this process is known as presbyculosis. So after the age of 30, many people cannot hear frequency above 50,000 Hz, and after the age of 50, frequency above 12,000 Hz are harder to hear. In the age of 70, it becomes difficult to hear sounds above 6,000 Hz, which makes speech comprehension more challenging. Number 2, loud exposure. Constant or extreme exposure to loud noises can permanently damage the delicate structure of the ear. For example, concert, clubs, machinery, and especially earbuds or earphones. Earbuds. Earbuds can make sound 6 to 9 decibels louder than over-ear headphones. Health experts recommend that no more than 1 hour per day at 60% of maximum volume to protect the hearing. Next, type of hearing loss. Number 1, conductive hearing loss. So this occurs when sound cannot travel efficiently through the outer or middle ear. Next, type of hearing loss. Number 1, conductive hearing loss. So this occurs when sound cannot travel efficiently through the outer or middle. And there are many causes of this one. Number 1, earwax buildup, middle ear infection or otitis media, or osteosclerosis. It is a condition where stiff bones in the middle ear becomes immobile due to abnormal bone growth. And there are also treatment for this one. Number 1 is hearing aid. It is to amplify the sound. In some cases, surgery to connect the structure. Sensorineural hearing loss. This type results from damage to the inner cochlea, to the auditory nerve, or the brain areas responsible for hearing. And there are also causes such as damage to hair cells in the cochlea from the loud noise, aging, or toxic effects of certain medications. Poor blood flow, often worsened by smoking or nicotine. It also includes injuries or diseases that affect the auditory nerve of the brain. And there are also treatments such as cochlear implants. It is a device that bypasses damaged hair cells and directly stimulate the auditory nerve. In some cases, there are also advanced hearing aids or assistive listening voices.
The somatosensory system gives us information about body position, movement, touch, temperature, and pain. So basically, it tells us that this system helps us where our body is, how we move, and what we feel. And it might not seem as important as vision or hearing, but without it, we would be severely disabled. So, for an instance, some people who can feel pain often injure themselves, and without realizing it, which can be very dangerous. The vestibular system provides information about the position and movement of our head, helping us maintain balance. So, these organs are inside our inner ear, next to the hearing structures, and there are two types, which is the otolith organs and the semicircular canals. The otolith organs sense head tilt and straight line motion, like when a car starts or stops, while the semicircular canals detect the head rotation, like when we speed around. And now, moving on. The skin is our main touch organ. So basically, it's the largest organ in the body and acts as a boundary between the inside and out. And our skin has layers. First is the epidermis, secondly, dermis, and subcutaneous tissue. And it protects us from dehydration, dirt, and bacteria. And some skin is hairy, like on our arms, and some is hairless, like on our lips, palms, and soles of our feet, which makes those areas very sensitive. And the skin can be thin, like on our faces, or very thick, like on the bottom of our feet. And now, moving on. The skin is our main touch organ. So basically, it's the largest organ in the body and acts as a boundary between the inside and out. And our skin has layers. First is the epidermis, secondly, dermis, and subcutaneous tissue. And it protects us from dehydration, dirt, and bacteria. And some skin is hairy, like on our arms, and some is hairless, like on our lips, palms, and soles of our feet, which makes those areas very sensitive. And the skin can be thin, like on our faces, or very thick, like on the bottom of our feet. Touch receptors. Mechanoreceptors respond to physical movement like bending, stretching, or pressure. And these receptors are like little sensors that detect touch, stretch, and pressure. And they are found in the skin, joints, blood vessels, and even organs. For example, your stomach uses them to tell you when it's full. And some receptors are good at detecting fine details, while others detect deep pressure or stretch, and free nerve endings sense pain and temperature. In receptor adaptation, some receptors respond quickly and fade, while others respond slowly and keep firing. So receptors like Meissner's and Pacinias respond at the start and stop of touch, like when you first put on clothes, but when you stop feeling them. Merkel's and Ruffinis, on the other hand, keep sending signals as long as touch continues, like constant pressure from holding an object. Now, why does sensitivity varies across the body? This is because fingers and lips have more receptors that are close together, so they can detect very small touches. That's why you can feel tiny details with your fingertips, but not on your back. A simple test is the 2-point discrimination test. On your fingertip, you can feel 2 points close together, but on your back, it feels like 1 point.
So, touch pathway. Touch starts with mechanoreceptors or skin sensors, and the signal travels to the brain through sensory fibers. These fibers are grouped by size and speed. First is the A alpha fibers. A alpha fibers are the biggest. They mostly carry muscle information but not touch. Next, A beta fibers carry actual touch info from receptors like Meissner's corpuscles, Merkel's discs, Yersinean corpuscles, and Ruffini's endings. Next, A delta fibers are smaller, myelinated fibers that transmit pain and temperature quickly. Next, lastly, C fibers are small and unmyelinated, so they're slower and they carry pain, temperature, and itch. So basically, the bigger the fiber, the faster the signal travels. These fibers enter the nervous system through the dorsal roots of the spinal cord. Each spinal segment corresponds to a strip of skin called dermatome. An important clinical example of this is shingles or herpes zoster. When it reactivates, it usually affects a single dermatome, causing a painful rashes in that area. That's because the virus makes the sensory neurons more sensitive. Now let's talk about how touch signals actually travels. So first, the mechanoreceptors in the skin send signal through the dorsal root axons into the spinal cord. The signal doesn't synapse until it reaches the medulla. That's why the pathway is so fast. In the medulla, the signal crosses over to the opposite side of the brain. That explains why touch on the left side of the brain is processed by the right hemisphere and vice versa. From the medulla, the signal goes up through the medial lemniscus to the thalamus, specifically the VP nucleus. That thalamus acts like a relay station before sending info to the primary somasensory cortex in the parietal lobe. That's how a touch on your skin gets turned into a conscious sensation in your brain. Now let's talk about the somasensory cortex or S1. It's located in the postcentral gyrus of the parietal lobe. This is just behind the central sulcus, the space separating the parietal and frontal lobe. S1 is divided into four main areas. Area 3A processes information from joints, tendons, and muscles, basically movement feedback. Area 3B deals with size, shape, and texture like light touch. Area 1 focus is mostly on texture. Area 2 handles size, shape, and movement. The secondary somatosensory cortex, or S2, is found in posterior parietal lobe. Unlike S1, which deals with basic touch, S2 handles more complex processing. S2 helps us with 3D spatial awareness, like knowing how objects are arranged in space, body position, meaning where your body is without you looking at it, and it also integrates different sensory types together, kind of like combining touch, vision, and movement information to make sense of the world. Finally, let's look at what happens if this area gets damaged. If the primary somatosensory cortex, or S1, is injured, the person will have problems feeling and moving the body part linked to that brain region. For example, if the part of your brain is damaged, you might lose touch sensitivity or struggle to move your hand properly. On the other hand, damage to the secondary somatosensory cortex, or S2, especially on the right side of the brain, can cause what's called neglect syndrome. In this condition, people literally ignore one side of their body or their surroundings, almost as if it doesn't exist. So, both S1 and S2 are crucial, not just for touch, but how we interact with our environment.
So moving on, temperature. In order for a person to kanang ma-feel ang temperature, the body uses thermoreceptors. These thermoreceptors are responsible for sensing temperature. So, yeah, basically, kuan sila, mura sila mga detector, kibali, pag masense nila nga, uy, bugnaw, mo react to ang mga thermoreceptors, then ila da yung i-deliver sa body, mag-send sila signal nga para ingon din sa brain nga, uy, ila init, bugnaw, inana. However, na downside, like they don't respond to touch or pressure, only ragid sa temperature, like selective sila. So yeah, sa temperature ragid ang thermoreceptor limited. So ang thermoreceptor di ay kay naay cell membranes. It is called ang kaning special protein sa ilang membrane that act like temperature gauge kay ang TRP. TRP means transient receptor potential or ion channels. So, yeah, mo to ilang purpose. Mag-open sila gate, kibali, i-abre nila ang door for for the thermoreceptor to sense something cold or warm. Also, to note nga, ang thermoreceptor di ay kay thermoreceptor is a free free nerve endings. Yeah. Also, to add, thermoreceptors are not evenly spread, and there are tiny temperature spots. Some spots bugnaw, some spots are cold, and the skin between spots is less sensitive to temperature. Moving on, ang normal skin temperature sa isa ka tao kay about 32 degrees Celsius. And if mula pa sa gali ang mabatian sa lawas, if it exceeds 30 degrees Celsius, like mupik siya og mga 45 degrees, ito na din mo take over ang pain receptor. Ito na din, you will feel the heat na dayon, like mapasok ka, inana. Na siya murag threshold kibali kung unsang kanang makaya ra sa imong lawas nga temperature kana, yeah, and inana gid ang that would happen if mo peak siya again 45 degrees Celsius. So pag-abot sa kato ganina kay abot to siya sa heat receptor. Now, let's move on to cold receptor. It starts firing at 35 degrees Celsius. 35 degrees Celsius. What? Oh, wait. Negative ni? Yeah. Yeah, 35 degrees Celsius. Tapos, it will fire more as it gets colder down to 10 degrees Celsius. Tapos, same sa heat. When they meet the threshold, like sa heat, but again, this is cold receptor. Ang threshold nila kay below 10 degrees Celsius. So, cold receptor stops firing and the skin feels numb. And also, some cold receptors also fire above 45 degrees Celsius. This is called paradoxical cold response and not fully understood. Like, wala pa kayo study daw. So, yeah, ang mga nerve fibers that are used in this process are the cold receptors. Again, send signals through the group A fibers plus the slow C fibers, group C fibers. And again, the warm receptors use only C fibers. And the pathways for this, as shown in the PowerPoint, yeah, it's a bit simple, pero ang kakakita nyo sa picture kay like thorough na procedure. However, if we break it down and make it simple, it is just pain and temperature signals travel together from skin padulong sa spinal cord padulong sa brain. Kana ra jud din yung dumduman para mas masabtan ninyo kayo ang picture. Now let's move on to pain. Although we know pain, like mo na siyang sakit nga imong mabatian sa imong lawas. Like kailangan bisan sakit kay siya bay bisan sakit kay siya class, kailangan gyapon nato, we need it for us to probably determine kung unsa ang problem sa tong body. Kay without it, like dali ra gid kayo dali ra kayo ta mamatay pananglitan lugar. You have an headache pero dili mo kakabatian na kasakit. Oh, saon man na nimo pagkaibalo nga naka-headache, di ba? Tapos dili siya matambalan. It will get worse as time goes by and probably could lead to kanang delikado na situation. Basin day tumor na to or aneurysm ba inana. You can never know pag wala kay kakabatian nga pain. That's why pain is very important for us human beings. Yeah. Although take note, pain may be important pero dili pud sila inana ka showy. Nayuban fatal conditions like cancer, your body don't show or let you feel pain kanang sagunson bitaw, like dili gyud nimo magakabatian ng kasakit pero naagid siya dira. Dili lang gid kay nimo ma-feel kay gamay ra gid kay siya. Pero still nagyapon kay kakapatian nga kasakit. And that is important. Tapos kung too much pud kayo ang pain, it will hurt. Tapos mo lagi din to ang ingon ganina, if wala ka kabalo nga sakit na day kayo, then yeah, it could lead to something dangerous na severe rather. Pero pag gani if you feel the pain like too much na kayo, you could do something about it. You could go to hospitals for treatment, medical treatment. Inana. Continuing, so if ganina sa thermoreceptor, sa temperature na thermoreceptor, sa pain na apoy, receptor ang pain, and it is called nociceptors. Nociceptors are same with thermoreceptors. They are free nerve endings. However, the differences, ang nociceptor kay ga-detect og harmful stimuli. Mao lagi to, sagpaon ka. Mako sagpaon ang self. Sakit kay kakapatian ako. Tungod na siya nociceptors. Tapos, they respond to different kinds of danger, specifically mechanical pain, from cuts, pinches. I can't cut myself kay masamad ko. Sakit. Sharp objects, di po na ko matusok ang self. No. And, ang process na ni inside your body kay, pressure opens ion channels, kato ganina. And action potentials. Kabalo naman mo ani. And, dito na dayon mag-transmit og pain signal. And next is thermal pain. Moto. Mabatian nimo ang kuan. Na-explain na sa ako ni ganina katong too much pain too much coldness or too much heat could cause pain. Example lang, ibutang niyo mong kamot sa boiling kettle. It is put under the fire tapos imong gipikit imong kamot dito for a long time. So, syempre mabatian gid imong kasakit. Kung ibutang sad nimo, if you put your hands in the refrigerator for too long, you'll feel numb tapos masakitan pud ka. Diba? Di makabuang so di na nimo buhaton. And next is chemical pain. Mga acid naman nga makasulod sa imong body. Example, lactic acid. One example lang, lactic acid after exercise increases H+ ions, hydrogen ions, tapos mag-result siya soreness. And it's also important to take note na ang pain kay dili lang siya physical. Pain isn't only physical. It is also affected by culture, emotion, context, and past experiences. So dili ra physical tanan. Panangitan, emotional pain. For example, someone is looking down on you kay ano daw lagi kanang ilang perceptions sa imong self kay lain bitaw, ilang gina-project ang ilang insecurities mo, tapos ikaw said wala ka kabalon sa bation mo din to nabatian nimo nga sakit di ay nana. Although dili gyud siya minsan necessary nga kailangan gyud nimo bation ng kasakit pagignan kanila sila insecurities, pero namo gyud times nga makurat ka ba. So inana nga aspect. Ambo kasaban ning kadayon. Kasaban ka kay kuan kanang nakinabuhat tapos mo din to naapektuhan nimong emotional aspect na sakitan ning ka. Okay, moving on. Ang the way pain goes through your brain. As you can see in the picture na dira. Pero I will explain it. Nerve fibers carry pain signals. Group A fibers, they are fast and myelinated, carry sharp, quick, or they carry the quick ouch pain. For example, sa palong self, okay. So pag sang paon akong self, they send signal mo ng mga fast mga group A fibers. Like pag sa paon akong self, mabatian ako diretso. Oy, sakit oy. Yeah. That is the group A fibers. Tapos isa, group C fibers, they are slow and myelinated. For example, ang example gid ni ang kanang pinaka-common na ni kay man ni siya, carry dull aching pain. The most common experience of this kay kanang sa emotional aspect atong ganina nga ang sharing experience. Yeah. And they both mainly use the neurotransmitter glutamate and sometimes substance P. And then they enter to the spinal cord. Okay. Pain signals enter through the dorsal root. So sa sa likod, ibali sa likod. Root sa likod. And they synapse kay dorsal lagi kay di ba? If you remember dorsal, yeah. And next is they synapse in the substantia gelatinosa in the dorsal horn of the spinal cord. Substance P. And next is substance P helps create long-term changes in how pain is processed. Explains why pain can feel worse or different depending on past experiences. So, kung imong nabatian sa una kay sakit kayo tapos pagbati like kanang extreme pain, example sa lang ni sa nga emotional aspect lang ni extreme pain imong nabatian kaniadto, pero as you grow for yourself tapos kaka-realize na nimo mga butang inana nagamay na lang imo ang kasakit ato kay nabago naman imong perspective. atong abutang. Tapos before pa siya mosulod sa brain, nagka-crossover pa siya. From the dorsal horn, pain fibers cross to the opposite side of the spinal cord. So mubali na siya sa pikas. Kanina naman siya sa likod, mubali na siya sa atubangan. And then they join the spinothalamic pathway, which carries pain and temperatures signals up the spinal cord. So musaka na siya padulong sa spinal cord. Tapos dagto na din siya mosulod sa brain. Ang katong mga nisaka padulong siya sa signals travel up through the brainstem. Tapos padulong din siya sa thalamus. From the head and face, signals use the trigeminal nerve. Padulong sa spinal trigeminal nucleus, padulong sa trigeminal lemniscus, tapos sa thalamus na sa daan. Yeah. Namoto ka tong complex. That is a complex. Tato din akong gishare pinakaw na motong mga matong simple lang for you to understand better. So, pagsulod sa brain, napanay process again, otro. Pagsulod na sa thalamus, pain signals go to two places. The first place is the VP nucleus or the ventral posterior nucleus. Keeps pain info separate from touch info. So, yeah. Kanang mora, simple lang siya. I-separate rin niya ang pain info sa touch info. And next one is the intralaminar nuclei. Send signals to the anterior cingulate cortex. The ACC handles the emotional side of pain. So moto, pag-anticipate nimo, imong kahadlok, fear, anticipation, fear. Somatosensory cortex handles the location and intensity of the pain. And last one, the pain and reward circuits. Pain also activates the nucleus accumbens, which is part of the reward or addiction system. I think my own understanding on this is pag-tolerate bitaw nimo sa addiction lang like na ka sa pain ba, you know, masokista ba, masochist bitaw, like addicted sila sa pain. Yeah, murag mo nang example addicted sila sa pain nga they find pleasure bitaw yeah, mo na kung understanding This system analyzes whether a stimulus is good, pleasure, or bad, pain, but important for survival. So, kailangan mapuna tog pleasure usahay, pero masochists are extreme. Sobraan na sila. So, in terms of moving on, in terms of managing pain, napoy process, our body delivers process also to manage pain, obviously. So, yeah. The first one is endogenous opioids and receptors. So, people have different numbers of opioid receptors in the brain. More receptors equals to stronger natural pain relief and less pain felt. For example, in an experiment, people with higher opioid activity felt less pain from saltwater injections. So if gamay mong receptors, so you would feel the pain. Pero if taas mong this is a natural body occurrence, by the way. So if taas ang imong receptor, then you'll be fine. Pero if mubo gani, then you will feel the pain. Not to like really extreme, pero you will feel the pain. Next one is the gate control theory. Ano siya kay theory ni siya ni Melzack and Wall 1965. So pain signal can be gated by other sensory input. So mablock daw sa pain receptors ang mablock daw sa, for example, lugar. This is mentioned other sensory input. So, mablock daw sa touch signal ang pain signal. So, mag-interrupt sila na there is an interruption. For example, when you rub your elbow after bumping it, touch signals compete with pain signals in the substantia gelatinosa or spinal cord. So, in that way daw, ani nga theory, your pain is reduced. So, maura na. Like, basic example for basic understanding. Special mention under this theory kay, this is like example lang sa pain. Ang chronic pain. Pain that continues after healing. Pag regular pain, there's more activity in the thalamus. However, pag chronic gani ang pain, more activity in the prefrontal cortex, like link siya sa memory. So, ang basic suggestion ani nga example of pain is you're kind of like kanang remembering the pain rather than sensing a new pain. Inana siya. Like dili nimo ma-sense balik so balik like mag-provide siya new bitaw gikan na tong experiences, pero okay, it will just remember pain, like madumduman na to niya mo nang mabatian nimo inana. So next is stress induced analgesia. So kani ang stress daw kay maka-trigger sa endorphins or natural opioids nga maka-reduce sa pain. Ang example ani kay Climber Joe Simpson survived a fall, broken leg, frostbite, and extreme cold by continuing to move despite the pain. So guys, if matapilok ninyong tiil, for example lugar, nagbasketball ang isa ka tao. Miska nag-ankle break, miska na naguba na yung ankle. Nagyapoy night times na mo ang katong stress sa yang body kay makakause og kanang pain reduction. However, pag mauman na siguro ang dula dito guro niya good mabatian ang kasakit. I know this doesn't happen a lot, pero what if inana ang may tabo pag basketball player ka, no? And lastly, ang pain tolerance. Mo taong gingon ganina katong mga masokista, they will endure the pain, they will tolerate the pain for pleasure. Inana ra. And everyone, and kita man jud tanan, we have the same level of pain pinakauna. Tapos as time goes by, if dili galit na to if we can't tolerate it, dito na din mag-change, like na din disparity. For some makaya nila, for some no, you can't. So inana ra. If taas imong pain tolerance, so dili ka masakitan diretso, inana kung mubo di masakitan ka diretso. That's basically what tolerance is. And that's all for my part. Thank you.
Chemical senses, smell and taste, and their integration within the sensorimotor system. These senses detect chemical molecules in the environment, distinguishing them from other sensory modalities like vision or audition. Historically, while Kant considered smell dispensable, both smell and taste are crucial for survival, identifying safe food and warning of dangers such as smoke, indicating fire or spoiled food, signaling toxins. Anosmia. The loss of smell can significantly impact quality of life, often leading to depression due to the strong emotional and memory associations tied to scent. These underscore the profound role of olfaction in human well-being. Olfaction initiates when odorant molecules suspended in the air enter the nasal cavity. For detection, these molecules must be both airborne and capable of dissolving fat. As olfactory receptors reside within lipid-rich tissue, adequate airflow through the nostrils into the nasal cavity is essential for odorant delivery. Nasal congestion, as experienced during a cold, obstructs this airflow, preventing odorants from reaching receptors and thus impairing the sense of smell. Olfactory sensitivity varies based on several factors. Age commonly correlates with a decline in olfactory acuity. Gender differences indicate women generally possess a more acute sense of smell than men. Additionally, smoking is associated with diminished olfactory function. The phenomenon of olfactory adaptation occurs when prolonged exposure to a specific odorant leads to a decreased perception of that scent. This rapid desensitization is evident when one no longer perceive their own perfume or cologne after a short period. Olfactory receptors are situated within the olfactory epithelium, a thin tissue layer in the nasal cavity. This epithelium contains not only the receptor neurons but also support cells that produce mucus and basal cells, responsible for receptor regeneration. Unique among neurons, olfactory receptors have a turnover rate of approximately 4 to 6 weeks. Each receptor cell is bipolar, featuring two branches. One branch extends to the epithelial surface and is covered with cilia, tiny hair-like projections. These cilia are bathed in mucus, facilitating the dissolution and binding of other molecules. Odorant detection occurs when molecules bind to receptors on the cilia. These binding triggers the opening of ion channels, allowing Na plus and Ca2 plus ions to enter the cell, causing depolarization. If sufficient depolarization is achieved, an action potential is generated. This signal then propagates along the receptor's branch, converging with other signals to form the olfactory nerve or cranial nerve 1. This nerve transmits the signals directly to the olfactory bulb, the primary processing center, before relaying it to the higher brain regions for comprehensive interpretation. Humans possess approximately 1,000 distinct types of olfactory receptors. However, the perception of a vast array of smells is not due to a one-to-one receptor to other mapping. Instead, the brain integrates the patterns of activation across multiple general receptors to identify specific scents, enabling the discrimination of countless others. Beyond typical odorant receptors, mammals also possess specialized receptors for pheromones, which are social chemical signals, example in urine. While their precise function in human social behavior is still under investigation, these receptors highlight the diversity of chemical sensing mechanisms. Two principal theories explain odorant discrimination. The lock and key model proposes that odorant molecules have specific shapes that precisely fit into the complementary receptor sites. The vibration theory suggests that receptors respond to the molecular vibrations of odorants, accounting for instances where similarly shaped molecules smell different or differently shaped molecules smell alike. Both theories posit that other molecules dissolve in mucus, bind to ciliary receptors, generate signals via the olfactory nerve, and are subsequently identified by the brain. The olfactory pathway originates with receptor cells in the nose transmitting signals directly via the olfactory nerve to the olfactory bulb. Within the olfactory bulb, receptor axons converge glomerally, each receiving input from a single type of receptor cell, indicating initial odor organization. While the olfactory bulb performs preliminary sorting, the complete recognition and identification of smell occur in higher brain areas. The axon from the olfactory bulb form the olfactory tracts, which carry these signals deeper into the brain. These delicate fibers are susceptible to damage, which can result in permanent anosmia and contribute to depression. The olfactory pathway is unique because, unlike other sensory pathways, it bypasses the thalamus and projects directly to the cortex, suggesting a more direct connection to cognitive and emotional centers. Key brain regions involved include the orbitofrontal cortex, responsible for determining odor pleasantness, and the limbic system, amygdala, and hypothalamus, which mediates strong links between smell, emotion, memory, and motivation. Furthermore, olfaction is intimately connected with mental health. Alterations in the sense of smell have been observed in conditions such as schizophrenia, depression, and alcoholism, highlighting its integral role in neurological function and overall well-being.
Hello everyone. So I will be discussing about taste. Taste first developed to protect us, and many bitter things in nature are poisonous, so tasting bitterness warns us not to eat them. And flavor is not just from taste. It also comes from smell, texture, and temperature. That's why when you have a cold and cannot smell, food tastes bland. Basically, taste works like a safety system. Bitter flavors often mean poison, while sweet, salty, and umami flavors help humans survive by signaling energy, minerals, and protein. But taste is not enough. We also need smell. Hello everyone. So I will be discussing about taste. Taste first developed to protect us, and many bitter things in nature are continuing. Taste buds on the tongue, mouth, and throat have receptor cells that can detect different flavors such as sweet, salty, sour, bitter, umami, and baby fat. When molecules from food bind to these receptors, they trigger electrical signals. For example, salty flavors come from sodium entering the cells, while bitter flavors block potassium channels. It means that our taste buds are like little detectors. They find five main flavors, which are the sweet, sour, salty, bitter, and umami. And some scientists even think fat counts as a sixth taste. But food must dissolve in saliva first for us to sense it. That's why a dry continuing taste buds on the tongue, mouth, and throat have receptor cells that can detect different flavors such as sweet, salty, sour, bitter, umami, and baby fat. Next, activated taste cells release neurotransmitters to afferent fibers, and these are known as the cranial nerves 7, 9, and 10, sending signals to the medulla, thalamus, limbic regions, and the gustatory cortex and insula, or known as the frontal operculum. In simple words, when taste buds are activated, they send signals to the brain through three nerves: the facial nerve for the front of the tongue, the glossopharyngeal for the back, and the vagus for the throat. These signals travel through the brainstem, then to the thalamus, and finally to the gustatory cortex, where the brain recognizes the taste. And some signals also go to the limbic system, which explains why taste is linked to emotions and memories. It's like how your favorite food can remind you of home. And for the last part, the sensorimotor integration. When we lick and chew food many times, our brain collects repeated signals about the taste. The timing of these signals helps the brain know exactly what the taste is. Taste also works together with touch and temperature in the mouth. That's why texture and warmth or coldness can change how we experience flavor. Basically, it means that when we eat, the brain doesn't just get one signal. It gets many signals as we chew, and that helps it identify the taste better. But flavor is not only about taste. It's also about how food feels, such as crunchy chips taste better than soggy ones. Ice cream tastes different when it's frozen compared to when it's melted, and chili peppers feel spicy because of pain receptors on the tongue. So that burning feeling is actually pain and not the taste.